intervention for family caregivers of persons with Alzheimer's disease or related to dementias and multiple chronic conditions. So I am a Master's of Nursing student, and I've been working with Dr. Wendy Duggleby on this study since about January, just doing some research and stuff, and it's just kind of getting underway now. So we're just starting recruitment as we speak currently. So this is just a list of all the members of the study team. It's a partnered study between McMaster University and the University of Alberta. So some of the participants will be recruited from Ontario and half will be recruited from Alberta. So that's just a list of everyone involved. Then in terms of recruitment partners, this is a list of our partners as of right now. So we're going to be starting recruitment with the Alzheimer's Society and the Alberta Caregivers Association, and just kind of work with them first and then see where we're at and go from there, and then start building recruitment into the other partners later on as we go. So the two research questions that we are investigating is, does My Tools for Care, the online transition toolkit, increase hope, self-efficacy, and subsequently health-related quality of life in caregivers of persons with dementia and multiple chronic conditions compared with educational control groups? Then we're also looking at the costs of using health services. And we are going to be collecting data at baseline. So when people are recruited, after 1 month, after 3 months, and after 6 months, depending on which intervention they get, they'll be asked different surveys, but they'll be phoned at those different points throughout the survey. So this is what the website looks like. This is the My Tools for Care website. It's very user-friendly. I've been on there a couple times. So everyone who gets assigned to the intervention, the treatment group, will be given a username and password, and then they log in, change their password, and then this is what they see, just a quick introduction of how to use My Tools for Care, and then all the different sections of the website are on the left. So about me, frequently asked questions, and they can just click on any of those tabs and come and go, and it saves things as they are working on them, and so they can leave quickly if they have to and come back later. And yeah, and I think it's laid out pretty well, that it's fairly user-friendly. I spoke with Wendy about showing you all the website, but we're doing Google Analytics on the frequency of use of the website, so she doesn't want unnecessary kind of logins. Just once the study gets started, then we'll kind of keep track of how many times the participants are logging in. So I'll just give you these couple pictures of the website for now. So the study design, so we're doing a randomized control trial. So there's going to be 180 participants altogether. So we're going to hopefully recruit 90 in Alberta and 90 in Ontario. And then of those 90 in Alberta, 45 will be assigned to the intervention group, which is given access to the website, and 45 will be given educational materials, so brochures from the Alzheimer's Society. And the other thing that's really important is participants will be blinded as to what group they are in. So the big thing that we're stressing, that we're telling people when we are recruiting them, is that we're testing out two different approaches to supporting caregivers. So not necessarily that one of them is going to be given a new intervention, the other one's not a standard intervention, but there's just two different approaches in which, then just evaluating which one is more effective. So then, as I said, we're phoning them at baseline in 6 months and asking them some questionnaires. And the questionnaires on average should take maybe about 30-45 minutes, depending on which time point it is. Sometimes there's more questionnaires and sometimes there's less. So hopefully not too much time. It also depends, I guess, on the answers too that they have. If they have lots of information to tell us, then that'll take obviously a bit longer. So the inclusion criteria for the study. So we're looking for family caregivers of persons over 65 years of age who have Alzheimer's disease and related dementias and multiple chronic conditions. So that's 2 or more chronic conditions. But the other important thing is they're very broad definitions. So for caregivers, anyone who's providing spiritual, emotional, financial, or health-related support to the person with dementia. And it does not need to be, the title is family caregivers, which is a little misleading perhaps, but it does not need to be a family member. It can be a friend. It can be someone who lives out of province and phones and supports the person with dementia. It could be a neighbor, a close neighbor. And for chronic conditions as well, it's a fairly broad term. It's just a condition that they've had for greater than 6 months, but it does not need to be diagnosed by a physician. And could be something as general as vision or hearing difficulties, maybe difficulty with walking or gait, which are all, I think, fairly common, maybe conditions for people with Alzheimer's disease or dementia. So we have a checklist of chronic conditions that we will use when we are trying to decide whether people are suitable for the study or not. So it just lists 2 pages of, again, very, very general, like hypertension, bladder difficulties, incontinence. Most people, I think, will find that there could be something. So we're also keeping track of the number of individuals who give us their contact information, and whether we then agree to participate in the study or not. We're kind of just keeping track of the number of people who are contacted, and then the number who end up participating in the studies, just so we know who refused or couldn't and why. They also need to be able to be fluent in English or relatively fluent in English, and the participant has to be over 18 years of age, and be relatively proficient at using a computer and have an email address, because they'll need this if they get assigned to the treatment group and have to log on to the website, the My Tools for Care website. So the exclusion criteria is pretty general. So if the person passes away during the study, it's going to change their hope, self-efficacy, all those kinds of things, and they're no longer going to be a part of the study. If the person with dementia resides in long-term care, then they cannot be a part of the study. Or if they're hospitalized and waiting for long-term care. If they're hospitalized and waiting to go home, or not going to be going to long-term care, then that's fine. They can be included. But if the plan is long-term care, then we're just focusing really on community, people who are out in the community. So like I said, we're hoping to start the data collection this month. We're just kind of getting all the surveys and everything up to date at this point and talking with people. So in terms of recruitment, so in Alberta, myself and Lori, who is the second data collector recruiter, and she's just starting with us now, will be in charge of kind of recruiting and collecting the data. So I've met with Arlene and spoke with her a bit about this. And so she's given me a list of the support group meetings in Edmonton, and I've highlighted some ones that I'm going to go to if that is all right, and just give a quick little presentation before the meeting starts, just a couple minutes, have some brochures on hand and answer any questions, maybe get contact information if individuals are willing to sign up at that point. And we have a travel budget, so I'm also able to travel to other cities. So Lethbridge or Red Deer, and check out some support groups down there too, if that is possible. At the Caregiver Coalition, I've given Anna some write-ups that she's going to put on in our newsletters and their website, just to kind of advertise for participants. And then we also have very fancy posters that we can display at meetings or anywhere else that we can think of. That's all. I've taken us to the end of the presentation. So I guess in terms of recruitment, if there's any other ideas or things that have worked in the past or not worked in the past, I think being there in person, like traveling to the meetings and people having a face to kind of put with the study might be effective, but I don't know if anyone else has any other ideas or experiences in the past that has worked or not.
we're now unmuted?
I can hear you.
Okay, good. I'm just kind of wondering as I'm listening to you talk. It's Brenda in Lethbridge.
Hi.
Hi. As I'm listening to you talk, and I'm watching the screen roll by, and I'm looking at the blind piece of the two parts of participants.
Yep.
I'm just kind of curious as to how, if the people from our support groups and from our known population have been with us for quite a while, they have already have a fairly good immersion in traditional methods.
Right.
So I'm wondering if that's, if there's some kind of leveling for that.
Right.
Or
that's a good question. Yeah. Because then they'll know, obviously, if they're not receiving any new intervention, that is a good question. Yeah.
And they aren't starting at the same, at the same starting point.
Right.
Our support group people have probably been in First Link and had all the brochures and the contact with the First Link staff, and then also participated in the support group.
Okay.
So yeah, it just was it flagged for me as we were going through.
Okay, no, that's a good question. I'll have to talk to Wendy about that. Yeah, but that is a very good point. Yeah. Are there any more questions? Cindy, do you mean in terms of will we be recruiting in Grand Prairie? Yes, Alberta wide. So I could definitely, if you think that would be helpful, come up to Grand Prairie and talk to some of the support groups up there. I can't hear you, Arlene.
Can't.
Oh.
Her little speaker thing is on.
When you're talking like that, they can hear us.
Arlene, is that you?
that's my voice. It's picking it up there. See? Responding to your question.
Oh. Well, I don't know.
And the other thing, I think we can approach it in a way of it, they already have the intervention, if that's the group that they get recruited to, the standard educational materials they get now, then they already have them. So we can just see at this point in their journey if how they are rating them in terms of their hope, quality of life, health care spending, whatever else. So we can, even though they already have the intervention per se, and they may have been using it for a little while, but we can just still at this point in there capture kind of what.
This is about the caregiver.
Yeah.
Mm-hmm. Sorry, I'm not sure what SL4 is. Oh, supportive living. Wendy said assisted living, supportive living are fine to be included. So just long-term care.
Okay.
Yeah.
When are we getting these questions? Oh, it's all on there. You have to click. But we think if you had it, a copy of what?
Well, she's going to come around, isn't she?
So I'm not sure the out of Edmonton. Yes, that's great. I was just going to ask if it's possible to maybe email me dates, or I don't know if on the website if I can just look up support group dates.
Yeah. For Lethbridge, you can look up support group dates on the website. Just be forewarned, the June date is wrong.
Okay. Okay.
Cafe.
Not for the support group.
Not for the support group, but for the cafe, which is a dual support group. So.
Okay.
It's always the last Monday of the month, or the fourth Monday of the month.
Sure. And Arlene, who would I talk to in advance to let them know that I'm coming if I'm going to come to a support group meeting?
You could just call either one of us.
Yeah, you could talk to Vedna in Lethbridge for the support group.
Okay.
And Brenda for the cafe.
Okay, perfect.
That one I will go to. If you could do June for Lethbridge, that would be perfect for our support group.
Okay.
Actually, we could. Third Wednesday of the month, so
You're in May.
or Tuesday of the month. Sorry, it'd be the 16th.
June 16th.
Of June.
Okay.
It starts at 7 in the evening.
Okay.
don't know. Maybe come for 5 minutes. I'll wait some for 5 minutes. Wendy?
Do you have a printout of this little PowerPoint that you did this morning?
I can email it to you in a PDF.
Oh, that'd be nice. Thank you. It's Vedna.
Okay.
B. McGill at alzheimer.ab.ca.
Okay.
Yeah.
Perfect. That would be great. Christine, if you could email it out.
The right thing. So Christine's going to email. Tracy. She's got 2 screens now.
Yeah.
Well, that's what she's ordered. I don't know if she's got them yet.
Okay, so if that's all, then maybe we can, end this meeting. Thank you very much for coming online to listen to me for a few minutes today. And hopefully we will be in touch with all of you soon.